Welcome! So you're gearing up for your phlebotomy certification exam. You've definitely come to the right place. In this explainer, we're going to break down everything you need to know to really master capillary blood collection. We'll focus on those critical rules and the fine details that are not only going to help you pass your exam, but also make you a super confident and skilled phlebotomist.
Okay, let's just dive right in. We are going to cover the what, the why, and the how of capillary collection. Think of this as your go-to guide for performing the procedure with both confidence and precision. You'll see, we're going to focus really heavily on the two things that matter most: patient safety and sample quality. If you get these right, you're absolutely on your way. So here's our game plan. We'll start with when and why you'd even choose a capillary puncture. Then we'll move through the proper setup and technique, lock down that all-important order of draw, cover what happens after the collection, and then we'll finish up with a quick review of the key takeaways for your exam.
First up, why even do a capillary puncture at all? I mean, it's not always the right tool for the job, so knowing when to use it versus a traditional venipuncture is a totally fundamental skill.
Capillary collection is really the go-to method in a few key situations. For newborns and infants, it's so important for limiting blood loss and preventing something called iatrogenic anemia. That's just anemia caused by drawing too much blood. It's also perfect for patients who have fragile or hard-to-find veins, and for those quick point-of-care tests, like a bedside glucose check, where you only need a tiny drop of blood.
Now here's something really interesting. The blood you get from a capillary puncture is actually a little different. It's a mix of arterial and venous blood, so some of the test values will be different from a standard venous sample. For example, a properly warmed capillary sample will have higher glucose levels, but lower levels of things like total protein and calcium. This is exactly why it is absolutely critical that you label your specimen as a capillary sample.
Okay, let's move on to the setup. Being super meticulous with your preparation is your best defense against common errors. It's really the key to ensuring you get a high-quality sample.
So a crucial first step is to warm the site. This process, it's called arterialization, and it basically increases blood flow to the area, which makes collection so much easier. But here's a critical safety rule you have to remember. The warming device should never, ever get hotter than 42 degrees Celsius. Any higher and you risk burning the patient. This number is a huge point for both patient safety and your exam.
So how long do you apply the heat for? The standard is about 3 to 5 minutes. This gives the capillaries just enough time to dilate, which brings more of that arterial blood to the surface. The whole goal here is to get a nice, round drop of blood without having to squeeze the site, because squeezing, that's a major reason samples get rejected.
Now for the procedure itself. Where you stick and how you stick is, well, it's everything. Knowing the exact location and the proper technique is just critical for both patient safety and for getting a sample you can actually use.
This table breaks down the only approved sites. For adults and older kids, you're going to use the fleshy part of the middle or ring finger a little bit off-center. We skip the thumb and index finger because they tend to have calluses and more nerve endings, ouch, and the pinky is just too thin. For infants, we always use the sides of the heel, staying away from the center to avoid hitting that heel bone.
And here's another number you just have to memorize for your exam: 2.0 millimeters. That is the maximum puncture depth for an infant's heel. If you go any deeper, you risk hitting the bone and causing a really serious painful infection called osteochondritis. So you always have to use a lancet that's specifically designed for infant heel sticks.
This is a fantastic pro tip. Look at the patient's fingerprint. You want to make the cut across the lines, not parallel to them. This simple little step helps break the surface tension and encourages the blood to well up into a perfect round drop that's so much easier to collect, instead of just running down the finger.
All right, let's talk about the single most important sequence you need to commit to memory for capillary collections: the order of draw. Seriously, getting this wrong can contaminate your samples, lead to inaccurate results, and force a painful redraw for the patient. Nobody wants that.
Okay, here it is. This is something you absolutely need to have memorized. First up are capillary blood gases, because they are immediately affected by air. Next are the EDTA tubes. For hematology tests, you have to collect these before the platelets start to clump up. After that, you'll collect any other tubes with additives. And last are the serum tubes. They need the blood to clot, so you collect them last so the clot activator doesn't contaminate your other samples.
So the collection is done, but your job is not over. Proper specimen handling and patient aftercare are just as crucial as the puncture itself.
So what do you do after the collection? A few really crucial things. As soon as you cap a tube with an additive, like an EDTA tube, You gently invert it 8 to 10 times. Never ever shake it. Then label every single tube right there at the patient's bedside with at least 2 identifiers, and always note that it's a capillary specimen. Apply gentle pressure with some gauze until the bleeding stops. And here's a key safety tip. Never use adhesive bandages on infants. They can cause skin irritation and they are a serious choking hazard.
All right, let's do a quick review. These are the key takeaways you absolutely need to know for your exam. Think of this as your highlight reel for success.
This table breaks down the most common mistakes. Squeezing or milking the site, that introduces tissue fluid and breaks red blood cells, which is called hemolysis. You always have to let the alcohol air dry completely. Wet alcohol also causes hemolysis, and it really stings the patient. We've already covered the order of draw and puncture depth. Getting them wrong leads to contaminated samples and patient injury. Knowing these errors is the key to avoiding them.
So let's lock in those key numbers one last time. The maximum warming temperature is 42 degrees Celsius. No exceptions.
The maximum puncture depth for an infant's heel is 2.0 millimeters. This is so vital for preventing a serious injury.
And finally, the unbreakable rule, the capillary order of draw. It's always blood gases, then EDTA, then other additives, and serum tubes are last. Following this sequence is the only way to protect the integrity of every single sample you collect. You know, mastering these details, the temperatures, the depths, the sites, and the sequences, that's what separates a student from a certified professional. It's about more than just passing an exam. It's about ensuring patient safety and providing accurate, reliable results every single time. You've got this.